guys, welcome to my channel. I'm so glad to have you here. If you're new, please consider hitting the subscribe button down below. I'd love to have you along for this journey. Today, we are talking about, or actually, we are looking at what I kept in my nursing clinical bag. So, for clinicals, I just had a backpack. Here it is. It's just a Candy's backpack that I got from Kohl's. Absolutely adore it. It is pink with flowers, super girly, super feminine. Absolutely adore it. And it's huge. It's a lot bigger than you think it is. So let's take a look at what's inside. So when I unzip it, this is what it looks like. It has all of my essentials. And so we'll just start back. First step, we've got this blue folder. It can be any color folder. It just needs to be a sturdy folder. So in this folder, I kept some loose paper for when I needed to write notes about my care plan patient. I have some extra brain sheets in here. I made this one. I don't know if you can see it, but I also downloaded one from NRSNG, which is an excellent resource website for anybody, nursing student, pre-nursing student, new grad nurse, anybody. So this is it. You can see lots of great information. And I actually used NRSNG when I was prepping for the NCLEX. So if you'd like to know how I pass the NCLEX in 75 questions or less, just comment down below and let me know. I graduated in March of 2018, took the NCLEX in April 2018, and I passed in 75 questions. And I really only did 2 weeks of solid study time. So if you want to know how I did it, comment down below and I'll let you know. What else did I keep in here? So a lot of times during clinical, your clinical instructor will give you pieces of paper with important information, or I don't know, sometimes you just need to bring paper to clinical. And so having somewhere to put it where you can keep that paper from getting wrinkled, keep it looking nice, is beneficial. So folder, highly recommend. Next up, I have a clipboard. I love this clipboard. I got it from, where does it say? I got it from Amazon, but it's white coat clipboards, and it's the nursing edition. See that? Is it focusing? It's not really focusing. Oh well, I tried. So it's pink. I love pink. And it folds, which is super important, because when you are jotting notes, whether you put a full-size, just blank piece of paper, jot notes, or if you put a full-size brain sheet on here, you can fold it up and either leave it on the counter, and since it's folded, all of your patient's personal information is protected and you don't have to worry about it, so HIPAA compliant, or you can stick it in your scrub pant pocket. It fits perfectly, and you can just have it with you whenever you need it, along with these nice little tips and tricks. Love it. Highly recommend. I'll put the link down below so that you can find everything that I'm talking about. Next up, I love this. I got this from Amazon as well. It's a whole book of brain sheets. It's so handy. So here. I don't know if you can see that. This camera's not really focusing, but it has the essentials. It has all of the systems: neuro, respiratory, CV, GI, GU, musculoskeletal, IV, pain, labs. It's got these little boxes down here that are numbered with time. So if you need to remember at 1 p.m. you're going to do a dressing change, just jot that in the 1 o'clock tab, or at 9 a.m. you need to pass morning meds, you just drop that in there. It's wonderful, and they tear out easily, so at the end of the shift you just tear it off and put it in the shredder and you're good to go. I absolutely adore this book. This is absolutely essential, especially if you are a nursing student, because, well, you may be thinking, I don't need to lug around a great big drug book. I can just use the computers at my clinical site, or I can just look it up on my cell phone. Well, if you think about it, you won't be able to get a computer. Computers are scarce for nursing students because the nurses and the doctors and physical therapy, occupational therapy, speech therapy, respiratory therapy, everybody else is going to be using those computers. So because you're a student, you're kind of coming last when it comes to priority for those computers. And when you're at a clinical site, you never, ever, ever, ever want to pull out your phone because it's going to look like you're texting, it's going to look like you're on social media, and you don't want that. As a student of your school, you are in your school's uniform, you are representing your school. If you've seen my video on 7 things you must know before you start nursing school, check it out if you haven't seen it, then you'll know that reputation of your school is super, super important. And you, as a nursing student at a clinical site, are part of that reputation. So keep that in mind. Take your Davis Drug Guide to School, and please always, new grad, new nurse, nursing student, look up your medications before you pass them to your patients. Don't ever just pass a medication blind, ever. All right, so another thing to have at clinicals and note cards and whatever book you're studying from. So at my school, we used ATI as our NCLEX prep, and so every class had a corresponding ATI book. This is my Adult Med Surg ATI book. I used my little Post-it tabs to help me study because actually this ATI book, even though it is ATI specific, also helped me in the classroom with all of our tests and exams. So great book. If your school uses ATI, definitely get the whole collection. Love it. And take it to clinicals so that when you have downtime, you can study up. Note cards. I had note cards everywhere, including in my clinical bag, because again, if there's downtime, you can pull it out and flash through a few cards, get some studying in. It's, as a nursing student, any time that you can find to study is so worthwhile and valuable. So I highly recommend having whatever book you're studying and some note cards in your clinical bag for downtime. Also, this is the same notebook that I carried through clinical and then as a new grad on the floor. It is just a 5-star notebook that I got from Target. Absolutely adore it. But it fits perfectly in my scrub pocket. So throughout the day, if there's something new that I didn't know already, or sometimes doctors will come through the unit and they'll tell us something that I didn't know. I can just jot it down and review it later. It's wonderful. Love it. It's very well loved, as you can tell. But highly recommend having a tiny notebook that you can stick in your scrub pocket. Invaluable. Last but not least, this is my very favorite. This is literally a shower caddy. And you're probably thinking to yourself, Teanna, you have a shower caddy that you took to clinicals? Yes. Yes, I did. Let me show you why. I got this from Target. It's rose gold with little lace flowers. I love it. It's gorgeous. But you open it and all of my clinical essentials are in it. So in the first pocket, I've got my clinical scissors, my bandage scissors, which I got from Amazon in hot pink. Those are in here. Love them. I also have a pair of Gerber scissors. I don't know what you call them. Just scissors, nursing scissors. Those are in there. Love. And then I've got alcohol wipes. These are very important because you're going to want to wipe everything down. Wipe down your stethoscope, wipe down your pens and pencils, your pen light, your scissors, anything that you had in your pocket throughout the day. Wipe them down with alcohol before packing them away. So I've got alcohol wipes for that. I have got my badge rail, but I don't have my badge anymore. I've got my badge rail. Of course, it's pink. But on it, I've got this little badge buddy, which you can get from Amazon, and I'll link that down below. And it's a dry erase marker because in every patient room there's a whiteboard, and so you'll want to make it a habit of going into the room and writing on the board, student nurse Teanna. That way your patient knows who you are and what you are there to do for them for that day. And then make it a habit so that when you become a nurse, you're already in the habit of writing your name on the board so that your patients know exactly who their nurse is. I also have a lanyard in here. There are a lot of people who like lanyards. I am not one of them, but I have one because I wanted to try it out at first. So it's actually very cute. I got it from a local uniform store in town, and it's cute. It really is. The reason why I don't like lanyards is because it hangs pretty low. First of all, you can't really even see how low it's hanging, but it's almost to my belly button. So when you are doing patient care, you're leaning over the bed and your badge is in your patient's bed. And then you go to the next patient's room and you're leaning over them, caring for them, and your badge is all over them, all up in their bed. And so you're cross-contaminating. Some nurses go around that by sticking their badge in their scrub top pocket so that when they're bending over, it's not going into the patient, but I'm still not a big fan. The reason why I wanted to talk to you about lanyards is because the patient population that most nurses are caring for are elderly. They're confused whether or not it's acute or chronic. Doesn't really matter. They get confused in the hospital, especially, and then when you're leaning over them with something that's cute, especially like this, they reach for it and then they grab it, and they usually have a really strong grip. And so you don't want your patient grabbing onto your lanyard and pulling you down into their bed with them. That makes for a disastrous circumstance. So if you do decide to get a lanyard, make sure that it is quick release. That way if your patient reaches to grab for it, it'll just come off and you won't be dragged down into their bed along with it. And it's magnetic, quick release. But the great thing about these lanyards is that even though they are quick release, it's still a pretty strong magnet. So it's never just fallen off. And I haven't worn it very much, but I can still yank on it pretty good without it coming off. In my second pocket are all of my pens in clinical, and once you do become a nurse, you're going to want a lot of black pens because it's pretty much all you're going to use, black pens. So I've got 3 just Paper Mate standard black pens. Oh, I have a Bic in here as well. I've got 2 mechanical pencils. That way I don't have to worry about sharpening. And then I have got a pen light. This is a pen light that comes in a pack of 2 from Amazon. Absolutely adore. Definitely recommend. In my third pocket, it's just my personal stuff. My hand sanitizer is trying to escape. Just a Bath and Body Works mimosa scented. Oh, that smells so good. Hand sanitizer, absolutely adore. Next, I've got Cottonelle Fresh Care flushable wipes because, you know, got some, got a hair tie and some clear shea butter lipstick, lip balm, and it's just, I think it's by Hey Honey, or is it called Hey Honey? Ooh, I don't know if I can pronounce this. Besame Mucho, Kiss Me Generously. Super cute. I don't know if that'll focus. I don't think that's focusing. I tried. And then this last pocket, it's a zip pocket. I love this. I hold my stethoscope. This is my stethoscope from Clinicals. Super cute. It's a keyless scope, and it's their cardiac edition, cardiac style. I don't know. But keyless scopes, you know, when I was going to nursing school, I was trying to find a good quality stethoscope with for a lower price tag, if that makes sense. So I wanted a quality stethoscope, but not for the really expensive quality price. So I found Kiloscopes. It's a Japanese-based company that is comparable to Lippin. And I have to say, I absolutely adore it. Great sound quality, super comfortable when it's in your ears. It has a really good seal, and it's so soft. So if you're in nursing school and you're looking for something that's quality and I wanted a cardiac stethoscope because cardiac stethoscopes usually have the best sound quality. They're able to pick up on those subtle heart tones. And so that's what I was looking for, something that could pick up subtle tones, because as I was learning to use my stethoscope, I wanted to be sure that I was hearing everything that I should be hearing. I didn't want to get a crappy stethoscope and then train myself on something that wasn't good quality. So I really wanted something that would help me to learn so that I could hear all of the sounds. And this really did it for me. I love it. It's nice and flexible. And as you can see, I've had it in this bag for gosh knows how long. And my tubing doesn't have any kinks. It doesn't have any cracks. It's not bent anywhere. It's beautiful, great quality. I cannot say enough about this brand. And of course, I got it in this beautiful pink. They've got these great fun colors. And the thing about that is, when you're in the hospital, your stethoscope just tends to walk away. Doctors borrow them, other nurses borrow them, respiratory therapists borrow them, and then they forget they're wearing them because you put it on your neck and you just walk away and continue about your day. Let me tell you, there is nobody who's going to walk away with a bright pink stethoscope. And if they do, they won't get very far. So that's another thing. When you're choosing your stethoscope, try and get something that's a bright color, something that's noticeable, something that's unique. Because if somebody saw someone else besides me walking away with a stethoscope, they'd be able to easily look at it and say, hey, that's Teanna's stethoscope. What are you doing with it? And it would find its way home to me. So I love Kila, but definitely get a brightly colored, unique stethoscope that'll be unique to yourself. And I think that's it. My bag is completely empty. So that's what I had in my clinical bag. All of these things are great. Thank you for watching this video. If you liked it, please click the like button down below and subscribe. I can't wait to see you next time. Thanks so much.